Hello, my name is Shonda Richardson, and I'm from Lehigh Acres, Florida. I came to the University of South Florida in fall of 2010 to pursue a bachelor's in psychology.
Hi, I'm Heather. I came to USF in spring of 2011. I transferred here from Hillsborough Community College. I started out as a psychology major.
Hi, I'm Shamery. I am from the Dominican Republic, transferred to USF in 2010 from St. Petersburg College with a psychology major.
Hi, my name is Candice Ormsby. I am from Tampa, Florida. I came to USF in 2009, and I came here transferring from HCC. And when I came from HCC, I really didn't know what I wanted to do. So I just took different things, and then I ended up in the behavioral healthcare major.
I decided to become a behavioral healthcare major because I liked the idea of taking all of the theories that I was learning in psychology and being able to apply it to the real world, to people in this community in Florida. I wanted to be able to have both sides of it so that when I went into the field, I wasn't just sure of the thought process behind it all, but about the actual people dealing with it.
Decided to become a behavioral healthcare major because it was more practical. I felt like I was learning a lot more about the field instead of just learning about theories and just reading the books. I was actually getting there and getting more experience, being more hands-on with people.
It's all about how to cope inside, about coping skills. And I like to talk to people, and I love to help people. And that is one good thing about being a mental health tech, because I get to talk to all these people, and I spend the most time with them, more than the nurses, more than doctors, more than the case managers. So I get to know them. And I've realized that, no matter how difficult their situation is, they really just want to talk to somebody.
In the behavioral healthcare major, since I chose to do the applied behavior analysis minor, I took the practicum course, and it fulfilled the field experience credits. In the practicum course, I was able to learn the different types of interventions and then practice implementing the interventions with my peers. We would role play and go through, and we learned how to take data. We did discrete trial training, behavioral skills training, pivotal response training, all different types of interventions.
I did my field experience at Suncoast Kids Place. There they work with children that are going through a grief process and loss. I really like my field experience because I got to co-facilitate some of the support groups there. I got to work with children from 3 to 5, also with teen girls that were incarcerated and they needed support in grief and loss. So it really impacted me because I got to see a different type of field other than just substance abuse or just regular mental health.
I did my field experience at Hyde Park Counseling Center in downtown Tampa. They are a group that deal with women residentially. Dealing with that population really got me thinking about comorbidity, co-occurring disorders, and what it was like to actually work with the field that I felt so passionate about.
One thing that got me into the field was the multidisciplinary class with Larry Thompson. Love him.
My favorite behavioral health care professor is Dr. Larry Thompson.
I had a really good experience in Dr. Thompson's classes.
My favorite behavioral health care professor was Dr. Thompson.
With Dr. Thompson, he has a lot of experience and knowledge that has just helped me in this field and really introduced me to behavioral health care.
He really does work with you and what you need to do. He answers all kinds of questions that I had in regards to the field and the major.
He is a great professor.
He's very relatable, very nice, always willing to listen, even for how busy he is. Just a really nice guy.
Eventually I'm going to go hopefully get into the rehab and counseling program and hopefully try to become a licensed counselor. So that's what I want to do.
After graduation, I definitely would like to pursue a graduate program of clinical psychology, hopefully master's or doctoral. Then I would aspire to be a clinician. I want desperately to work with people dealing with body image issues or anyone in the LGBT community with their concerns.
After graduation, I would like to go to graduate school to complete my mental health counseling and become licensed.
Right now, I work at Progressive Behavior Management in Brandon. I plan to continue working there after graduation, and in January, I will sit for my certification exam to be a board-certified behavior analyst assistant. After working for about a year, I plan to pursue my master's degree in behavior analysis.
Mom and Dad, I just want to say thanks for always being there for me. You guys have been amazing helping me with my children, letting us live there. I know it was crazy in the house those days. I also want to thank my grandparents. You guys have helped me out financially. You guys have helped me out with the kids. I know you guys will always be there for me if I ever need you for anything. I also want to thank you for my babies, Gracie and Daniel. You guys have been the people who have kept me going. And I also want to thank my sister, because my sister has also been there for me, and she has helped me out a lot with my kids as well. I also want to thank my friend Michelle. She is the one that's actually helped me with papers and critique them for me, and she has always been there for me no matter what. When my daughter ended up in the hospital, when I had a crisis, she was the one that I would call, and she's always been there for me, and I really thank her for that as well.
I would like to thank my mom, Tondalea, and my father, Franklin, for being the biggest inspirations I could have when things get hard and you still have to find a way to push through. I would like to thank so many of my friends, but I'd probably say Heather, who has been there since I was in 6th grade.
I really want to thank my family and my friends for all the support that they gave me while being in school and while having a child. It really did help me a lot. I'm very grateful for it.
Mom, Dad, thank you so much for supporting me while I've pursued my career here at USF. You guys have been a great help, and I'm so glad that I'll be able to be the first one in our family to have a college degree. Austin, thank you so much for helping me proofread essays and revise them, as well as study for exams. You have been such a great support while I've been here at USF. I want to thank my family and friends one more time and say that I love each and every one of you.